right, thank you for joining us today. My name is Lauren Williams. I'm Adult and Community Services Manager for the Columbia Public Library, which is part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn. This program is co-hosted by the library and the League of Women Voters of Columbia Boone County. Today, we'll be hearing from a panel of mental health professionals and members of Children's Grove as they discuss youth mental health issues in our community. And before I turn things over to the League to introduce our speakers, I just have a couple of brief Zoom housekeeping items. To ask questions of our presenters today, as usual, we'll be using the chat feature of Zoom. So if you hover over your Zoom window with your mouse, you should see that chat icon that looks like a speech bubble to click and ask your question. If you're on an iPad or a phone, you may need to tap in the middle to see those tools. We are recording this presentation, so it will be available the next day or two on the League of Women Voters YouTube channel and the library's YouTube channel for future viewing. Now I'd like to welcome our moderator, Marie Scala. Marie is a Columbia Boone County League of Women Voters board member and a Columbia Boone County Board of Health member. Thanks so much.
Thank you, everyone. Welcome. And it's my pleasure to introduce our distinguished panel today. First of all, the full title of the presentation today is called Youth Teen Mental Health. It's not a solo sport. Everyone needs an assist. So we have four panelists assisting one another today. The first person to speak will be Chad Rose. He has been involved in special education since 2002. Dr. Rose was initially employed as a special education teacher at one of the nation's most diverse secondary schools, where he primarily served youth identified with behavior disorders. He completed his PhD at the University of Illinois with an emphasis in behavior disorders and quantitative methods. Dr. Rose is currently an associate professor, director of the Mizzou Ed Bully Prevention Lab, and Director of Graduate Studies in the Department of Special Education at the University of Missouri. His research explores predictive and protective factors associated with bullying involvement, bullying among youth with disabilities, and bully prevention interventions situated within a multi-tiered system of support. Our second speaker is Heather Harlan. Heather has served for many years as a prevention specialist and drug and alcohol counselor for adults and adolescents. Heather is one of the few professionals in the state who understands substance use issues from both prevention and treatment sides. She's also a family support group facilitator for the National Alliance on Mental Illness, or NAMI, in Columbia, a member of the NAMI Missouri Hall of Fame, and a member of the board of directors for the Youth Community Coalition. And Ron Rowe, our third speaker, is the director of the Youth Community Coalition. He's originally from Western Kentucky, and he moved to Columbia in 2008 to study law. He graduated in 2011 from the MU School of Law and practiced law as an attorney for the Missouri Department of Social Services until 2014, or from 2011 to 2014. In 2014, he joined the Youth Community Coalition. His current duties with YCC focus primarily on organizing community coalitions in Boone County to prevent risky behaviors in youth. And our final panelist will be Leslie Falhuber, Master's in Education, LPC. Leslie moved to Columbia in 1996 to attend MU, and she's worked in the mental health field since 1998. In 2012, she started doing outreach crisis counseling for the Columbia Public School District. Leslie has experience in a variety of mental health settings. In 2020, the pandemic created a unique opportunity to begin offering telehealth sessions for individuals and groups. Don't we all know about virtual gatherings? We're in one right now. Online SEL lessons for students and staff training on trauma during COVID-19, and mind-body stress reset tools. In the fall of 2016, Leslie began sponsoring Hope Club, which is now called Compassion in Action at Rockbridge High School. Club goals are to augment emotional and mental health for students in school by promoting kindness. They work with Children's Grove and are proud to promote inclusion, respect, and empathy at RBHS and beyond. So we'll get started with Chad.
Well, thanks everybody for having me. I'm really excited to see how many people are on this call today. And I appreciate the introduction. My name is Chad Rose, and I am the director of the Mizzou Ed Bully Prevention Lab in the Department of Special Education at the University of Missouri. And I'll go over a few things that we do just from the jump. The first thing is we were designed to really do policy evaluation. So we work with schools, districts, and states on evaluating policy to make sure their bully prevention policies are in compliance with state and federal regulations, but also substantive enough to impact the lives of kids. The second piece that we do is we do a series of trainings. We've developed trainings all the way from week-long trainings to hour-long trainings, both virtually and face-to-face. And I don't believe bullying is a bell-to-bell issue, meaning that I don't believe bullying begins and ends with school bells. So I think that bullying is a community issue. That's why I'm excited to be here with all of you. So we have trainings for community members and parents. The next thing that we do is we do skill-based interventions. So I've been studying bullying for a long time now. And what we've determined is two of the biggest predictors of bullying involvement are social and communication skill deficits. And so our interventions are designed to increase social and communication skill acquisition because we believe that social and communication skills and the mastery of those skills leads to lifelong positive outcomes, including reductions in bullying, but also supporting the mental health needs of our youth. We do all that to establish bully-free environments for all. Now, one of the first things I did in my career is we did a systematic review of the literature. And one of the common themes that kept coming up is this idea that boys will be boys and girls will be girls and kids will be kids. And another thing that we heard a lot is that bullying hardens you. It's something that kids have to go through to deal with the pressures of life as they grow up. Well, that's not true. Bullying doesn't harden you. Bullying tears you down. And bullying is hurtful, and kids don't have to go through that. The way kids build themselves back up after experiencing bullying is by the support systems that surround them. It's the same way we work with kids in dealing with mental health. It's the same way we work with kids in a lot of life aspects, is we wrap around supports and support needs for kids to build them back up. So they don't need to be torn down to be built back up. We can start that from the ground. Now, I want to be clear about what I'm talking about in terms of what bullying is. Bullying is an intent to cause physical or emotional harm. It is an imbalance of physical or emotional power, and the behaviors are repeated or likely to be repeated. So to be clear, not all forms of aggression are bullying. Bullying encompasses those three components. But really why we're all here is the fact that bullying impacts all of life's facets for our youth, including mental health, but it also has impacts on psychosomatic symptoms, behavior, both internalizing and externalizing, social relationships, and academic outcomes. So bullying really impacts the whole child, and that's why it's so important for us to intervene. Now, we're here with the library, and so I thought I would share a little bit with you. I've done a synthesis of most of the literature, most of the children's literature in bullying, and almost all of it begins with characters being introduced, then the bullying situations identified. Then one of four things typically happens. Adults will step in, peers will step in, the victim will run away, or the victim will stand up for himself, and then the bullying is resolved. And if we could get our children's book authors to stop right there, that would be great. It's a great story. But what happens is they don't. They add one other component to it, and that's the kids become best friends. The bully and the victim become best friends. And what that does is it causes kids and tells kids that they have to suppress their emotions. And so if we're talking about mental health, what we need to talk about is teaching kids how to emote. And it's okay to be angry. It's okay to feel hurt. And it's okay to talk to people about it. And so what we're hoping we can do with some of these messages is teach parents, teach adults, and generally teach our children's book authors to really tell the full story. Because bullying is a matter of perception. Kids experience similar things and internalize them differently. And so what we have to validate everybody's story. So I went through the definition of what bullying is. Well, to be perfectly honest, it doesn't matter. It doesn't matter how anybody on this call defines bullying. What matters is how that kid standing in front of you defines bullying and their real life lived experiences. And we have to validate those thoughts and feelings because that's how that kid is feeling at the time. And that's the support systems that we need to offer to kids, because often just being different in a noticeable way is a risk factor for being a victim of bullying. So some of the things that we do that we can help, listen. I think people are fascinating, so I'm always encouraging people to talk to one another, but more than talk, listen, and then follow up and ask the kid how they're doing later on. Give them advice. Talk to them about what you would do. Don't tell them, hey, if I were you, I'd do this. Tell them, hey, if I experience this, this is what I would do. And just give them advice. But most importantly, be there, listen, and follow up. A couple of other tips that we have for parents and adults is teach the kid how to like themselves. Teach that kid how to build themselves up and identify the things that make them unique and make them an individual. The next thing is help them make friends. And I know this sounds incredibly complicated, but ultimately it's our responsibility as adults to cultivate environments where kids can establish these friendships, because we know that having 1 to 2 good friends is really positive for our youth. And then the last thing for tips for adults in this area is telling or working with the youth on who they can talk to as adults. Like, what adults can they talk to? And so the other thing that I want to talk to you about is something that's very important to me and something that I've started to do recently, is how to talk to your kids. And it's not when you go pick up your kid from school, it's not saying, hey, how was your day? Because almost every kid, no matter what age, will say fine. It's asking the kid pointed questions like, what made you laugh today? Or tell me one thing that happened that was exciting today. Or what did you do at recess today? Or who did you play with at recess? Who decided what you played? So asking kids direct questions that they can't say fine or good, and getting into a dialogue. Because ultimately what we're trying to teach kids is we want to teach kids how to prevent bullying by inviting others into our group, having inclusive groups, by having conversations with people, and learning about all different types of people, but also embracing their individuality and recognizing that they are uniquely them, and that should be celebrated. But then recognizing that they're also never standing alone. This feeling of aloneness is really the crux of our problem. And always recognizing the importance of working together. So with that said, I believe that all of us can really make an impact in the lives of youth if we really focus and support our kids and cultivate these types of relationships. Thank you.
Thank you very much. Heather, you're up next.
All right. Thanks so much. It was a delight to be here today. As Marie, when she introduced me, said, it took me a while to figure out that I am one of the few professionals in the state that's worked in the substance use field on the prevention and the treatment end. Those two camps seem to live on different continents. And to have those to go, oh, these groups need to talk together more. So a couple of things, it's really important, especially during the pandemic, first of all, to have a basic grasp of what's going on in the teenage brain to begin with. And they do have brains. Aren't they remarkable? We love them. But to understand what's going on in the best of circumstances and the worst of circumstances, this obviously is not the best of circumstances right now. So my outline is pretty much 2 words and a phrase. The first word is valuable. The second word is vulnerable. And the phrase is what's rewarded gets repeated. So first, valuable. The teenage brain is extremely valuable. You see that teenager growing and the dramatic physical changes in that teen's body right in front of your eyes. And what we failed to recognize until about 20 years ago is that there are also dramatic growth patterns that continue long after they've even reached their physical height. And we just didn't know that. We didn't have the technology to see what was going on at the level in the neural pathways to understand what was going on. So the important thing that I want you to pay attention to is that the teen years are especially important for the acquisition of skill sets. A skill set are things that you keep layering up and adding to be good at something. It's not just something to get a job. You have to be good at showing up at a job and taking direction and getting along with people. It's a lot of different things working together. For example, riding a bicycle. It's not just about pedaling. It's about keeping your balance, steering, watching traffic, being able to signal and work the brakes. So if you think of that, teen years are about teenagers trying things and beginning to add skills and develop them and fine tune them into skill sets. Now, we knew for many years that 2-year-olds have a neurological event called exuberance, where there are a lot of neural pathways that are sent out to develop, to connect different parts of the brain. You see much more. I have a 2-year-old granddaughter. I see much more speech, begin to see beginning of fine motor development, etc. Amazing to watch. What we didn't know until about 20 years ago was that children also have a second exuberance about junior high, where they begin to develop more of these neural pathways, especially to the prefrontal cortex, which is the judgment part of the brain that does forward thinking. What might happen if? So that's the last part of the brain to develop. So this is a very valuable development to have those neural pathways. And this is a time when those decisions are being made as to which of those pathways are going to be strengthened, because in the later teen years, the brain actually prunes and systematically kills off some of those neural pathways. Seems to be a strategy to make a leaner, meaner thinking machine. But for whatever reason, the use it or lose it saying seems to apply to the human brain. Use it or lose it. So those neural pathways, the ones that are repeated, are the ones that are kept. Now, because of that, the human brain is also very vulnerable as it builds these neural pathways because of the phrase, what's rewarded gets repeated. These are really primitive hunter-gatherer brains. So I'd like you to, so what's rewarded, the brain is always thinking about. The reason we repeat any behavior, my friends, is because there's a reward. So the teenage brain, as any of us, is thinking about what behavior to repeat as they build or don't build skill sets. Now, if you have problems with strobe lights, you might not want to watch this next part. But I just want to do a little demonstration to help you get an idea of what happens when drugs are introduced into the human brain when it's young. As you think of your human brain looking out on a dark horizon, deciding what behavior should be repeated. Oh, I got hungry and I had a snack. That has my attention. I think I'll do that again. I was kind of tired. I went to bed early. Oh, maybe I'll try that again. Could use some money. I showed up for work. That has my attention. I'm more likely to go towards that behavior and repeat it because I got rewarded. Those are effort-driven rewards. I have to do something. I want a better grade on the test. I have to study for it. I want friends. Or accomplishments. I go out for the track team and I make an effort to talk to people. Those are effort-driven rewards. Here's what happens when we introduce alcohol, tobacco, or other drugs. It's a much stronger reward. It overpowers this little bitty thing. This can't compete with the simple reward of all you do is put the substance in your body. Why should I study for a test to feel better when I can just drink? Why should I do something with my friends when I can just hang out and smoke pot? These small effort-driven rewards cannot compete with on a young brain where the neural pathways are not developed. Does that make sense? That's the most important thing to remember about introducing drugs. It's much easier to help people who may have had neural pathways and positive supports already developed and they get off track. So it's very vulnerable. Now, with the pandemic, there's more trauma to children. There's trauma to us. We as adults have had to scramble, pick up, and use every single coping skill we had in any of our toolboxes and pick up some that we didn't want to or know that we would need. But the whole time, who's been watching us? Teenagers. All right? And they're made with neural pathways. That's how they learn. They watch us. People used to ask me, well, why do those kids want to drink? Because adults do. We have said adults do. So what teenagers are seeing is adults who are openly, even before the pandemic, but even more so now, coping with high levels of stress with alcohol, tobacco, and other drugs. I checked on the alcohol consumption in Missouri. Hard liquor sales have increased by 21% in the last year. Adults have made it clear they want to hit, they want it big. Teens are watching that. So whether they have access to it or not, that's the message they get. Is this how you deal with it? You have an online happy hour, you drink more wine, hard liquor, whatever it is. And whatever people's thoughts about marijuana consumption, no one thinks it's a good idea for young people, immature brains to have it, because of that effect of an effort-driven reward is they're deprived of that. So alcohol, tobacco, and other drugs introduced to an immature brain where those neural pathways are not developed is very high risk. And the high levels of anxiety and other mental health issues make more of a vulnerability. Kids are looking for just the same thing adults are. They want some relief. And when we continue to model that, that's what they're going to seek out. And when there's more in their environment, higher levels of use go up. Higher levels of use in tobacco and alcohol are evident in all age groups because it's easily accessible. And we don't do a good job keeping it out of the hands of youth. So 90% of addictions begin during adolescence, according to the National Institute on Drug Abuse, 90%. So children couldn't get it if adults didn't buy it, supply it, if adults would lock it up, if we would card consistently and have policies in place where we adults don't create an environment that it's available. Finally, for you as voters and as parents, well, what can you do? Well, again, to be able to be more intentional, these are difficult times, to be intentional about how you are handling your levels of stress. Are you modeling, I think I'll go for a walk rather than just drink. I think I'll reach out to other people to help me. How are you modeling taking care of your stress? Are these strategies that would be healthy for a teenager? Also think about don't buy, don't supply, lock up, check your supplies of any alcohol or legal drugs that you have accessible. And finally, for you as voters, all teens, we need support. And so looking at supporting policies that help curb adolescent use. As I said, we don't do a good job now of keeping alcohol and tobacco out of the hands of youth because they're able to get it. But when we supported a no tobacco, zero tobacco policy, tobacco 21, it makes it much harder for high school kids to get tobacco. So those kinds of policies that are research-based, science-driven can do a lot to help our kids, but to be more intentional, to understand our teens' brains are valuable, they're vulnerable, and what's rewarded gets repeated. Thanks so much. Thank you.
Thank you very much. Next on our agenda is Ron Rowe.
Thank you, Marie. And thank you. I want to thank the library for having us today and the League of Women Voters. We appreciate this opportunity to talk about this topic. I've had this happen often. I follow Heather Harlan and I have to follow strobe lights. And so I don't have audio visual. It's just me today. But the flip side of that is I do get to present or work with Heather and Leslie and Chad. All these folks are in the network of people that work with Youth Community Coalition, and I'm proud and happy to be in this type of setting with them. I always learn something too. That's something for me that I get to do every day. So youth community, I want to start off. My focus is going to be, in some sense, piggybacking off of what Heather said. I think that one of her main takeaways is the importance of adults in the outcomes for youth of all kinds, in particular mental health outcomes. But just to step back, Youth Community Coalition, you may or may not know, we've been around since 2005 in the Columbia and Boone County area. And we are a prevention coalition, an organization that pulls together all of your youth serving agencies, organizations, any group that really is interacting with youth and families in our area is, at least in theory, a member of our coalition. And we come together to work on preventing youth from engaging in risky behaviors and in helping to promote positive behaviors. Obviously, with things like substance use prevention, we're attempting to increase mental health resources increasingly over the past few years. But I'll go back to what I mentioned the first comment there, that it really, a big part of what we do is helping adults to have the tools and resources to help youth. Now, there's all kinds of ways that we will, I won't call them interventions, but we can work with groups to increase programming and direct positive youth development type of programming for youth to increase those protective factors and increase the positive choices they can make. But really, I do think it's important to recognize the impact that adults have, and in particular, there's several areas we've looked at over the past couple years that we have as our strategic areas where adults can really make an impact. And mental wellness is one of our top strategic areas. Mentoring our young people, especially teens and preteens, our young teens. Of substance use prevention, there's plenty that adults can do, both with their own kids, but also as community members. And then out of school activities, providing activities for kids, positive activities outside of their time when they're in school. All of these are research-based prevention strategies that we can engage in. Now, back to that area of mental health and mental wellness. Our group in the recent past, and obviously like many groups, COVID threw us for a loop this past year, but our top priority in mental health and mental wellness resources was to increase the amount of adults trained in our area to address mental wellness issues for kids. And what we found, even in not being able to get together as much over this past year, is that there's a wealth of trainings that are out there. They tend to be focused, and this is actually an opportunity for us. They tend to be focused on people like teachers and staff of schools that are interacting with kids every day. What we really want to do, especially as we get back to more quote unquote normal activities and face-to-face activities, is increase the amount of laypersons out there in the community who have these trainings as well. Because again, getting back to that overall point, adults are best, especially the ones that interact with children regularly, are best situated to make a positive impact on those children. And so, we have a wealth of training out there, and getting that information out to community members and making sure they understand what's available is one of our primary goals right now. Now, a few other things, on that note, I don't want to highlight too many specific groups that we work with, but as I mentioned, we are a coalition of agencies working together to in different ways that we can increase things like these trainings or whatnot. But some of the trainings we work with in the recent past are things that are available. And we've worked with Heart Space, which is Lawrence and Associates, is offering some trainings for again, school professionals, but they've opened it up to others. And I think that in the future, you might see this out there. They have a nervous system reset training program that we've been working with them to get to some of our partners that I think is great, again, for adults to take care of themselves so they can take care and make sure that they're putting their best foot forward with the kids that they're interacting with. We've worked with, through Heather in our group, Missouri Child Psychiatry Access Project has a project to increase basically telehealth psychiatry through primary care providers, getting that word out. And then Always Face Family Access Center of Excellence is one of our main partners in getting behavioral health referrals in our area. Many of you may know about FACE, maybe some of you may not. Such a wonderful group that allows us to help kids and families get the help they need through referrals from all our different organizations. So a few other things, just want to go through my notes here. As we've gone through this past year, something I didn't mention, one of our, the main goal that we have over and above our strategic goals is to help the communities outside of Columbia organize coalitions like Youth Community Coalition. And over the past 4 years, we've organized groups in places like Hallsville, Ashland, Centralia, Surgeon, and Harrisburg. And what we got back this year with what we were able to do in those communities from remote mostly was that the kids they were resilient, but they did need more resources this year. And we tried our best to get some digital and online content to them to be able to get from their school counselors and whatnot to the children. But as we come out of this time, we hope to engage further. And some of the projects that we're working on now are some digital projects on youth voice and getting their youth perspective on what they're going through and what they want adults to know about. And I think, again, getting back to adults reaching out, the community reaching out to help kids have a voice. It's not just this year. Digital content is the way of the world as we go forward, and having them express themselves in the ways they want is going to be very important. I think I don't want to go too far. I want to leave it there. I do encourage you. We are an organization of a bunch of different entities in the community, but we're also individuals, parents and youth that are interested in helping to prevent risky behaviors in youth and helping our community be as strong as it can be to promote those healthy behaviors. So I would encourage you to reach out to me or anyone in the organization to get involved if you want to learn more about these things. And I'll look forward to, I see some questions, look forward to answering some questions as we have a little more time. So thank you.
Thank you, Ron. And now our final panelist, Leslie Falhuber.
Thanks for having me. I almost forgot to unmute. Good to see everybody, Ron and Heather and Chad, and appreciate you having us. And all of you that showed up, it's impressive how many participants are here and really care about mental health. I'm impressed, but I have been impressed with Columbia for a long, long time. And in fact, never more so than probably in 2012. Many of you, if you were in Columbia at that time, know that there was a voter issue that our voters passed to fund children's mental health services. And because of that, I was an outreach counselor for Columbia Public Schools before that was passed, and after, my job became a whole lot easier. There was so many phenomenal just resources created because of that funding. Ron mentioned one, Family Access Center of Excellence, FACE. FACE has been so helpful through this pandemic, hooking our families up with free sessions for their students and even for family members. So I thank them. MU Bridge, Dr. Lang-Young Walker, and that program over there has been just a godsend for our families. If you don't know about MU Bridge, please look them up. It's somewhere that we refer a lot to when students need some mental health help that might also include medication treatment. It is a bridge because we have such a psychiatry shortage in Columbia. They fill the gap. So if you're going to have to wait 3 months for an appointment you need now, they will fill gap with free sessions in between until they can turn your case over to the next psychiatrist. They're phenomenal. And again, that's all for free. And then we have had, Ron, you mentioned the Heart Space Clinic, providing the mind-body reset tools to essential workers, and that had included teachers. But that's something we even at Rockbridge were able to do for our teachers right at the beginning of this school year, because like you said, we have to have the adults regulated before we can help our kids be emotionally regulated. And so there are so many little things that we can all do to just get out of survival brain. And because we are in a pandemic and this is a collective trauma, whether we realize it or not, we're going to be scanning for threats. Our survival brain just does that to keep us safe. And we may not, well, we may be perceiving threats that aren't there. And so to be able to learn some tools that work pretty quickly and that we can practice often to keep ourselves regulated is really, really important. And I so appreciate our teachers taking the time to learn some of those skills in the midst of everything else that they were juggling in order to be that safe person and that regulated person for our students. I can't applaud CPS enough for having licensed professional mental health people in their secondary buildings. And that, again, is going to get even better. They're going to be in elementary schools next year. Again, because of that 2012 mental health tax, elementary schools, there's going to be some of those for mental health, for roles serving in mental health supports for elementary next year. So that's going to be wonderful because that's a lot on one school counselor. If you know how schools are staffed, a lot sometimes falls on one person to tackle issues of bullying and all the SEL lessons that have to occur and all the social service needs. So this is going to just improve, hopefully, family experiences who come through CPS. But I applaud our voters and I applaud CPS. I have to let you know that they don't have to provide a mental health professional at their schools, and they have chosen to do that for quite some time. And so we do a lot of referrals from our office. As an LPC, I don't provide the therapy sessions per se. We do brief crisis intervention and we do referrals out. I do offer drug education and alternatives learning as a group session for students in trouble for drugs and alcohol at school, and it's a way to limit their out of school suspension time. And we do harm reduction, mindfulness. We do a lot of social things, how to say no, all the different ways you can do that and save face, right? That's an important issue to our teens. And so the pandemic really, this issue is strange, right? So for some students, they had more family time than ever and maybe more protection and less time with peers to make some of those risky decisions. For others, they had, family members out working in their jobs and not supervised as much as they normally were and more access and work. So every student's experience was so different. I know you've seen the metaphor before. We're all in the same storm, but in different ships. That is so, so true. And we see evidence of that every day at school. I'm in a building with nearly 2,000 students. So we've got lots of different ships and lots of different experiences. It's been really, really interesting. I've learned so much. I've attended so many trainings over the summer to be prepared for whatever the fall was going to bring. And I've been able to learn how to do my job in remote, hybrid, and in person during a pandemic. So I think if you have questions, I'm curious what they might be, but hopefully I'm better prepared to answer them after all the training that I've been able to do this last year just to be better prepared. I never imagined living through something like this, and I think many of you can agree. It's just, it's something I think we have to acknowledge that our kids are facing as well, that this is not the world they thought they lived in. And so this is a big jolt to their systems. We have to meet them where they're at and validate that this is a trauma, normalize what that means and what that might mean for our brains. We might not have the focus we used to have. It might be harder to pay attention. It might be harder to study. All the things that we're seeing, in fact. So one of the things, I'll go back to the mental health tax again. And it looks like I'm getting some kind of warning that I'm at 6 minutes. So I may have to really wrap up quickly. But one of the things that funds is a mental health checklist that our students used to take 3 times a year. This year, they took it twice. And our most recent data, just from my school, I can only talk about Rockbridge. I don't have data from other buildings, but we learned our kids are having almost a quarter of our students report being at risk for focus and attention. That matches with being in survival brain. And so right now, I work on a behavior intervention team here at Rockbridge, and we're promoting a one thing campaign. It is strategy. We have a lot of distractions, and our society is kind of normalized, like your phone's going off, your email, all these things. And so we're really trying for both our adults and our students in our building to adopt a new strategy that will help with focus and attention that's pretty simple that anybody can do. And it's really just doing one thing at a time. And it has the nice benefit of also reducing stress and anxiety. And so, of course, we have numbers on that as well for our building. We did see that spike when we were in remote, and that has improved somewhat since we came back in person. But it's just, there's a lot to manage. And, you know, hopefully, Heather talked a lot about we're the role models right now. And I think that's so true and so important right now. So we have to show kids how to be resilient, how to adapt, how to hold on to some hope, and how to get through something like this. And we can do it. We are doing it. And I wish that were more the message we were hearing in the media. I think that would help everybody's mental health. But I won't go there, and I will take that as a time to stop.
Okay, well, thank you all very much. Very interesting perspectives from different positions within the community. We do have a question in the chat regarding, and it was answered in the chat, but I'd like to open it up for others to answer as well. When Colwell asked, can you give some examples of what you teach to lay people that are helpful? And I think she asked this during Ron's presentation, but I know several of you mentioned working with adults to help with their interactions with youth.
If the state of Missouri offers mental health aid free for Missourians, you can go on the State of Missouri Mental Health website and look for upcoming mental health first aid trainings. And they have many. You can locate it by your zip code and just find out how to be there, how to listen, how to support youth experiencing mental health need and adults.
And several outfits provide these different kinds of trainings already. And that was one of our projects. We're actually right at a place where we're putting together a directory for our members, but really it's free for the public. But I know Compass Health does several of those mental health first aid type trainings, trauma-informed care. There's plenty of, and other outfits do it. I don't want to just say it's them, but they're available. And we, as a coalition, trying to get that information out to as many community members as possible. I did also want to say, I don't want to take up the time, but Leslie reminded me in saying so, we are also a community-funded organization. We're a grant-funded organization that is funded in great part by the Children's Mental Health Tax, and have had that support for several years, and that's able, like so many groups, and thank the community for prioritizing children's resources in the ways that they have. And I can tell you, as kind of the tip of the spear of sorts of seeing all these organizations come and do their work, not just in Columbia, but in Centralia, in Harrisburg, in Ashland, and seeing the communities come together with the support of the entire county. It's very, we live in a great place for kids, and just want to say that and acknowledge that. I put it on my notes, and I don't always say it, and it's really a huge deal to live in a place like this. Just want everybody to always think about that.
I'll say when we're working.
Go ahead, Chad.
I'll say when we're working with parents and community members, a few of the things that we teach are warning signs and having critical conversations with kids. I think that's incredibly important to get a child's perspective, especially if it's your own child. And so those are the two pillars. What are the warning signs? How to have critical conversations, and then also how do parents work with schools to establish a parent-school partnership.
Great. Another question, a little different question. Barbara asked, do you introduce kids to gardening through CCUA to help reduce stress and do something relaxing and positive in nature? Do any of you have a relationship with CCUA, or is that is gardening an opportunity that our kids have here in Columbia and in boot camp?
You know, I'm not as involved working directly with youth anymore, but I think the challenge always with youth is having access to them. So there, I know I work with a number of organizations that would like have youth more involved. So certainly the Urban Garden Center is a great place, and this is a great place. I'm glad you brought that up. That was a great question, Barbara, to remind people to consider that as a coping skill. You know, make a list of, I'm not saying people are never going to drink to relieve their stress. Please don't misunderstand me. But do you have a list of 29 other things you can do that are accessible to you, that you are modeling instead of I'm only drinking, for example? So let's put the list of let's go do some gardening and do that as a family activity. Those are the more effective things when we try to take kids along, because the parents do have more access, especially when they're a little younger. When they get older, it's harder. But I would say that's one of the difficulties when you're working directly with youth, is actually having access to them, oddly.
And I can just add, and good to see you, Barbara. It's been a long time since I've seen you. It's good to see you on this call. Certainly different groups in CPS that I've worked with over the past 3 or 4 years have had different suggestions on how to use urban gardening or to work with different pupils through CPS groups, and also definitely out in the county. Different communities have urban gardening or gardening programs in some way with their students at school. As Heather said, getting to a select group of youth, the schools are almost always the best if you can do it, or at least that's my experience. But and that's certainly something that's in the works in different communities, the different school systems, from my experience working out there.
Just to add to that a little bit, I haven't done anything in terms of gardening, but I will also see another question on extracurricular activities. I do value gardening, and I do value extracurricular activities in terms of supporting all youth. We're currently doing a study right now where we look at the extracurricular activities of a large sample of youth, and we're connecting that to both mental health outcomes and bullying involvement. And prior to the pandemic, we were going to launch a physical fitness program in one of our rural school districts. And the program was designed to work with kids who aren't traditionally involved in extracurricular activities or athletics. And I'm a former football coach and strength and conditioning coach in past life. And so we're going to embed that into schools to see if that did in fact improve some of the outcomes for our youth who aren't traditionally involved in our sports, and often those kids that are traditionally marginalized. And it looks like we may be launching that hopefully in the fall, depending on what's happening with the pandemic.
Just as a follow-up to that, Ruth's question kind of included a focus on gender non-conforming kids. And that really wasn't mentioned in the presentations, but is there anything anyone would like to specifically address about the particular needs or risks of gender non-conforming kids?
I work a lot with non-binary and LGBT students here at Rockbridge. I think we have things to improve, certainly. I think one of the things you mentioned, especially, when we still have PE classes designated by gender, right? We have room for improvement. So things that have improved are, we have a new gender neutral bathroom students can use here. We have gender identity paperwork that we can do to get current names and pronouns into the system. So when a substitute comes, you don't have to rely on your teacher who knows you to pass that information along. When you come through the cafeteria line, you're going to hear the name you currently use instead of something that was on your birth certificate. And so I think we have GSA here at the high school level. Just recently, they've been allowed in middle schools as well, thankfully. And that is a Gay Straight Alliance, for those unfamiliar with that acronym GSA. And there are many, many things that students can join. I know a lot of those a lot of coping strategies were shut down for people, right? Clubs weren't active, people couldn't meet in person. Sports were one thing that seemed to still happen, but not in the same manner sometimes. But I tend to go on, so I have to watch my time, I know. But like, I think of our theater production and how everyone can be included, and our choirs, and our track. And I mean, there are so many events that are still accessible. And when you come across something you see that needs improvement, please bring it up to somebody at your school or with a city government, and help make that change happen. Sometimes it takes people willing to speak up if we don't know what we need to know. So I'm glad the question came up.
Thank you. Before it gets away from us, a while back, someone asked, are there opportunities for adults to volunteer? Are there opportunities for adults to volunteer?
With me, if we have adults that are interested in pursuing a graduate degree at the University of Missouri, sure, we have plenty of opportunities. So, just throw that plug out there. I'm the Director of Graduate Studies in the Department of Special Education. So if you're interested in a graduate degree, send me an email.
And Marie, a little less of a commitment. If you like to reach out to Children's Grove or to Youth Community Coalition, at the very least, there are a few other organizations, but that certainly are community-based, grassroots, so to speak, organizations where if you ask them what they're up to, I say us and Children's Grove are two that I can think of. And Heather, if you have others, I'm sure you might be able to think of others. I don't want to just narrow it to those two, but those are two community groups that focus on youth issues.
Well, one of the things I wanted to call attention also to NAMI, National Alliance on Mental Illness. There are opportunities to volunteer with that. If you just look through an internet search, there's NAMI Missouri that has a lot of opportunities, and NAMI Columbia, I'm a group facilitator with that. The other thing I'd want to call to mind, even if there are lots of people who are on this call today, on this conference, they don't really have time, maybe even to volunteer. Again, being more intentional with our interactions with youth, to be kind, learn their names. So I learned early they would never remember mine, but I made a priority run to learn that young person's name, find out, say, what do you like to do? And then ask them the next week, so how'd your track meet go? Be interested, pay attention, be kind, say, hey, I noticed this, or what, I really appreciated this, thank you. Pay attention. We tend to think they're not going to like us first. So we just think, well, I'm older, they're going to reject me, so I'm not going to pay attention. But if we apply those principles, learn who they are, show interest, ask open-ended questions, as Chad suggested, it can make a world of difference. It's your faith community, in your neighborhood, all kinds of places where maybe you don't get to volunteer with youth, but you can make a huge difference in the life of a young person just by being interested and encouraging and being, gosh, an adult who likes me, who knew, So that's always possible. That's within our reach.
The research showing relationships being more and more important. And as you can imagine, whether you've been educated in this or not, I mean, we're moving away in society towards less, more kind of abstract relationships, something that's digital. This year notwithstanding, I'm having an actual relationship with youth, like Heather said, showing interest, that goes a long way for anyone you'll interact with. So keep that in mind. I would say too, mea culpa, or I apologize. Thank you, Lauren, for putting our website up there. I will say our website's not always as updated, but it does have my contact information there. So if you have questions, you can certainly get to me. I'd like to say we're so busy doing our work that we don't keep up our website, but something like that. But you can certainly get in touch with us through that, the YC Squared website.
Kathy asked, are there youth mental health needs that are still falling through the cracks here locally, despite all the improvements that you've mentioned?
I would say absolutely, there always are. There's, for one thing, and who was it, Leslie, in terms of the bridge program, but there's such a huge shortage of child adolescent psychiatrists. It's not in Columbia, it's global. and that was before the pandemic. If you lined the children up who need behavioral health issues, it would be a line that would stretch almost from St. Louis to Higginsville. If you line up the child and adolescent psychiatrists we have to serve them, there's 146 for the whole state. So that line is about a length and a half of a football field, 206 miles versus 150 yards. So, and a lot of times when children need help, that's where things get gummed up. So there's a lot. I think waiting until things get acute is what's difficult. Like with substance use, we want to wait till that's acute, or we chalk it up to teen angst versus understanding a little bit more and getting help early. What we know now, first line actually, is a lot of that's falling to primary care providers. So if you believe that your child has a mental health issue, start there. So let's just take you to the doctor. Let's just have it checked out, you know? And it's usually easier to get a 17-year-old to the doctor than it would be to maybe a mental health counselor. Start there. Screenings are available. So they are falling through the cracks, but the system is working to leverage the resources we do have to get children help sooner.
And I think it goes to one of these other questions that was asked about systemic racism. We certainly could do a much better job in this community and in communities across this country addressing those needs for youth. I know my team, it's an immediate focus for us, but I think that we can all certainly do a better job in addressing those needs.
And I think one of those things, again, is for adults modeling behavior to be aware of our own biases and pay attention to those, and then also be willing to speak up when we see those in situations. Excuse me, when you say those people, what do you mean? So to be able to call it out in ourselves and in others, because we have to shine light on it. We cannot change behavior of which we are not aware. So we need to be willing to do the hard work of that.
And another thing we have learned from that mental health checklist, which I would not have known before, and I should have, it seems silly not to, but our kids, like a fifth of our kids report having at-risk levels of not being able to ask for help. And so what are the adults doing? Are we saying, no, I can do it on myself? So I think, Heather, that goes right back to your point. We as adults have to model that it's okay to ask for help. It's okay to get counseling, and it's okay to talk to your doctor about this stuff that can be taboo still in some family and some households, but we've got to do better there.
And, you know, sort of thinking out loud so that your team knows that's what you're doing. So, you know, I am really stressed. This is a level I'm not used to. I think I'm going to the doctor, instead of you just have an appointment out in the community. Let them know what's going on so they see that. So they see you not having it all together because they think adults have it all together, and let them see you and then see what you're doing to deal with it can be very powerful.
Well, thank you all very, very much for your contributions. This has been fascinating. And I want to acknowledge Barbara, who is the chair of the Lunch and Learn Committee for League of Women Voters and who schedules all of these monthly Lunch and Learns, which is a big, big job. And appreciate all of your input. Appreciate Lauren, especially your adding all the resources in the chat. And I want to draw people's attention to that there are a lot of links that Lauren has put into the chat that you can copy or you can go to directly from the chat, I believe. Mm-hmm. So, Barbara, do you want to talk about next month? Oh, you're muted. Sorry.
Thanks. There. Yeah, our next Lunch and Learn is June 8th at noon. And we'll have Janet Thompson, who's the Boone County Commissioner, along with the City Finance Director, Matt Liu, and they will update us and answer questions about where the money has gone for the from the CARES Act, and also the money coming in from the American Rescue Act, I think it's called. So that should be really interesting, and they will be able to take questions. So that's June 8th.
Thanks for having us, Barbara. We really appreciate the invitation.
Thank you. It was
Thank you.
very interesting.
Thank you, Barbara.
Very helpful.